I have read several of your blogs where you talk about palliative care and the need to plan for end of life, even at the start of a mesothelioma diagnosis. As a mesothelioma patient, I understand the need for it and why. However, my doctor hasn't been very helpful. I need some information on what title, position of a person offers palliative care, where I should look, what is the correct terminology to ask my doctor, the right question so I can plan for palliative care. Kind of like if I had to look up someone in the Yellow Pages, where would I turn? So that's a very good question, and like Ellie said, a lot of the hospitals and medical facilities now have a pain and palliative care department. And oftentimes when people are diagnosed with cancer, not just mesothelioma, they are part of the team as well. And so ideally, if you can bring in the pain and palliative care group right at the onset of your diagnosis and start building a relationship with them, because they'll get to know you just like everybody else, the medical oncologist, the surgeon, whatever your team is comprised of. They'll develop the relationship with you and they'll learn what works for you and what doesn't work for you, and as if the pain gets better. They really are very, very, it's a great asset to have on your medical team.
Yeah, I think one thing, people, when they hear pain and palliative care, they think, oh my God, it's over. I'm not, they think I'm not going to live, and actually, palliative care is control of symptoms. It's to make people as comfortable as possible with the symptoms. It doesn't necessarily mean that, the end is near. Their focus is to manage the symptoms, and the symptoms of mesothelioma, a shortness of breath, pain, chest pain, so they can have regimes, that, sometimes after surgery you might have a post-thoracotomy, neuralgia or something like that. They can, they're experts in the field. So, where would you go? I think like Lisa said, it would be, they're usually part of all the teams. But if you're, maybe you go to a mesothelioma specialist and now you're being followed by an oncologist, ask your oncologist. They would know. Because the oncologists, they work pretty closely with them. Because, the whole thing is to, the other thing that palliative care can do too is help with the psychological pain. The pain of having mesothelioma and having to deal with it. Yeah, because the anxiety, if you're short of breath, you get anxious. But did you get anxious before you get short of breath? That they can work with you. And again, coming back to what I said before, if you have a notebook and you keep very good records of what the pain, when the pain started, when it was its worst, that can help them get down to it, because it's tricky trying to figure out the pain regime, and everyone wants you to be as comfortable as you possibly can, and the way that they can do it is you're an active part of it. You just say you come in with your notebook and say, okay, well, I have continuous pain. They say, okay, well, we can for continuous pain we'll do this. Whereas maybe you're having a sharp neuralgia. Maybe you're having peripheral neuralgia. Maybe even if you're having, you have to stop the cancer treatments or the chemo treatments because it's just too painful and debilitating. But in order to sort that all out, you would be the expert on it. The patient would be the expert on it, and then explaining it to the specialist could really help you. But, I would say your oncologist, your medical team, like Lisa said, or anything.
So the one other thing I wanted to add, which isn't really about palliative care, but another person I think who should be on the team is probably a social worker, somebody who can, kind of just sit with you and kind of figure out where you're coming from, where you are emotionally. Maybe you just need someone to talk to, or maybe you need, some help with, I don't know, maybe with, lodging or something. And I think those social workers are really worth their weight in gold. So again, I would get hooked up with a social worker as well, because this is going to be a long road. And, the more support you have and the more expertise you have, your road is going to be that much smoother.
well, that brings up another good point, Lisa. Caregivers and caregiver support. Caregivers are, most of the care is given now, not in hospitals, but it's given by loved ones and family members at home, and that's a huge burden. If you're not used to, it's not a burden. Probably isn't the right word, but it's a huge responsibility. And if you're not used to, even if you are used to it, it's virtually impossible to take care of someone 24/7 and maintain your own health. I mean, there's a lot of studies out there that say that people that take care of someone and go through a long journey like this, and then at the end, if the patient dies, usually something happens to their health within a year, and they're not sure of the reasons, but they expect that it's probably the stress of collective stress of taking care of someone and going on this emotional journey with someone that it just takes a toll. So if you're the caregiver, you got to remember to take care of yourself. You can't totally, you just have to make time for yourself, and that's something that the families could do too. One of the first questions was how can we support, my cousin? Well, maybe you could take out your cousin's wife or your cousin's husband, just, go out to lunch or just do something to get them off of the whole thing. I mean, caregiver stress is a huge thing that's being studied and just actually being recognized in the last couple of years.
Mm-hmm.
It's just, it's huge.